So you kind of briefly talked on like for-profit CEOs and things like that. I was just kind of hoping to hear your take on the current state of healthcare and what recently occurred with their CEO.
Before I answer that question, I want to go back to the coach's question about marijuana, just so everybody understands where I stand. If John Morgan was king, I'd legalize marijuana all over the country, and I'd let you grow it at your house. So that's how I feel about marijuana. As far as the healthcare, think about this for a minute. There's only one place that we go ever, and we never ask what it cost. When you go to get your hair cut, what's it cost? When you go to buy a candy bar, what's it cost? When you walk into a hospital, none of us ever ask what it's going to cost. You can get a Tylenol pill over here for 20 bucks. It could be $1 at the other hospital. The of the insurance industry by healthcare is awful. It's off the charts. Our pharmaceuticals in this country are way more money than pharmaceuticals in his favorite country, China. And so you've got the healthcare where we don't ask what things cost, and then you got insurance companies who are fighting healthcare, and they're trying to gouge. The hospitals are trying to gouge. The insurance companies are trying to not be gouged. They're fighting, and guess who's stuck in the middle? The person who needs treatment, the person who has cancer, and they're saying, we're not going to do this, we're not going to do that. And then what happens? People go postal. People snap.
So would you be in favor then of a socialized form of healthcare in the United States?
I don't know how it will work. Listen,
Every other major country has a socialized form of healthcare.
when Obama was president, he came to my house as president. I supported Obama. I'm on the National Finance Committee for Obama. And one of the things that I really liked about Obama was Obamacare. A lot of people lost their House seats for voting for Obamacare. So listen, I'm all ears about anything we can do to get more medicine and more treatment to people. My brother-in-law is a physician up in Haines City, Florida. I have a clinic called the Morgan & Morgan Clinic where he runs it, I fund it, and we take care of everybody who has lost in the system who can't get care.
How do you deal with profiting over other people's injuries in your law firm?
Every business is in business to make a profit. If you don't have a profit, you don't have a business. On the other side of me and on the other side of my clients are insurance companies. Insurance companies do this. They take in premiums and they try not to pay claims. When they try not to pay claims fairly, that's when I'm hired. When I'm hired, the people who are hiring me cannot afford a lawyer by the hour. And the insurance industry, they live in this world. Deny, delay, defend. Their job is to never be